I do want to discuss this further, aphasia. Let's take a deeper dive and how Bruce Willis's life will change living with aphasia. Dr. F. Perry Wilson joins me now to do just that. Good morning, doctor. So tell us, what exactly is aphasia?
Aphasia is quite simply an inability to communicate or understand language. So it's not really a diagnosis as much as a symptom of something underlying. And of course, we don't have a lot of detail when it comes to Mr. Willis's condition right now. But certainly, I just would like to say that my heart goes out to him and his family. It can be an incredibly difficult condition to deal with.
Are there ways to improve this condition with therapy or such?
Yeah, absolutely. It depends on what that underlying cause is. The most common in the United States is an acute stroke. And with speech therapy after a stroke, aphasia can get dramatically better, particularly in the first few weeks to months after a stroke. So it's important that people get therapy early if that's the underlying cause. But it really does depend. There are other causes of aphasia that are less responsive to therapy. Important, obviously, if you're having any difficulty with language, speaking, understanding language, you get checked out immediately. This could be an emergent situation.
And seeing these headlines come out, I'll be honest, I was not familiar with aphasia and this condition, but I read, it's more common than people with Parkinson's disease. What do you tell our viewers who are watching? Are there signs to look for if potentially you think someone might be battling a condition similar?
So the abrupt loss of speech or difficulty with speech, word finding difficulty that seems of sudden onset that's an emergency department visit because of the risk of acute stroke and because of the benefit of getting treatment early in the case of a stroke. So that's the big take home here. There are dementia related causes of aphasia. And again, it would be irresponsible for me to speculate as to Bruce Willis's condition, but in general, there are dementia causes of aphasia. And so progressive aphasia, greater difficulty with communication or understanding over time also needs to be evaluated by a doctor as soon as possible.
You think he'll work again, or is it too early to tell?
Really, I couldn't speculate. We know so little about the underlying condition. As a huge fan, I would love it if he works again. If he's unable to, I'm so thankful we've got his incredible repertoire to go back to.
Dr. F. Perry Wilson, thank you so much for your medical expertise on this.